Welcome to Live from Size Lounge, weekly conversations with alumni of Iowa State University. At the ISU Alumni Association, we strive to facilitate the lifetime connection of Cyclones everywhere, communicating, connecting, and celebrating Cyclone pride. This series is made possible thanks to the more than 43,000 members of the Alumni Association. If you are interested in staying connected to the university and receiving all the benefits and services of being a member, visit isualum.org to learn more. Hey, good afternoon, everyone, and welcome into Live from Size Lounge. My name is Matt Van Winkle with the ISU Alumni Association. Thanks so much to everybody that's tuning in here to our Facebook Live or on YouTube, or listening to this on our replay, either on Facebook, YouTube, or on our podcast. If you haven't heard, you can now find our conversations with Iowa State alumni wherever you get your podcasts, Apple Podcasts, Spotify, Stitcher, iHeart, Google Podcasts, wherever you get your podcasts. Just search for the Iowa State University Alumni Association. And also let us know where you're watching from today, whether it's on the live or on the replay. Let us know where you're watching. We know Cyclones are everywhere, so leave a comment, tell us what city and state you're watching from today. We are excited to welcome Kristen Obbink as our guest today. Kristen is a 2006 graduate from Iowa State with a Bachelor's of Science degree in zoology. She continued her education here, becoming a Doctor of Veterinary Medicine in 2011. Kristen has worked for the Iowa Department of Public Health, developing and implementing Iowa's food emergency preparedness and response policies and procedures. She was previously the Associate Director of the National Institute of Antimicrobial Resistance Research and Education. Obbink is now a veterinary specialist at the Center for Food Security and Public Health at Iowa State's College of Veterinary Medicine. In July, she was named the Iowa State COVID-19 Public Health Coordinator, leading the university's comprehensive strategy to mitigate the risk of coronavirus spread on campus. Please help me welcome Kristen Obbink to Live from Size Lounge. Hey, Kristen.
Hi.
How are you today?
I'm great. How are you?
Doing really well. It's I was saying last week, it may be fall still, but it's feeling a little bit like winter here in Ames, but I know the temps are warming up. So how are you feeling on this cold Wednesday?
I am doing well. I'm a cold lover, winter lover.
That's right.
This is my season.
That's right. Well, we're getting just an early taste of it. And I guess we should be glad that there's not a home football game here right now. I guess that was last week too. So.
Yep.
Well, Kristen,
I dug my winter coat out this week, so.
Yeah, I think a lot of people were in that boat. Well, Kristen, before we dive into the work that you've been doing here on campus the last several months, tell me a little bit about your time here as a student at Iowa State and why you chose to study veterinary medicine after you got your undergraduate degree.
Sure. So, like many people in Iowa, I grew up on a farm, came from a family of animal lovers, so I was surrounded by animals my entire life and just have a huge respect for that human-animal bond. And so it was a natural fit for me to pursue an education in zoology and then later on veterinary medicine. And my plan going into veterinary school was to be a small animal practitioner out in clinical practice, which I did do for about 5 years. But then, of course, ended up in more of a public health type role, which we'll talk more about later, I'm sure. But my time at Iowa State, I absolutely loved it. Iowa State was a great community, a good fit for me, coming from being a native Iowan, being able to celebrate Cyclone spirit, and proud to be an alum from Iowa State.
Sure. And you also got your master's in public health, and your career path kind of took you towards infectious disease and epidemiology. So what was it about that area that interested you?
Yeah, so I really was exposed to public health for the first time while I was in veterinary school. And so that's when my career trajectory kind of shifted. And so I found public health was really a way that infectious disease and epidemiology, you kind of get to be a disease detective. And so it was a way for me to look at population health. So looking at not just individual animals, but looking at populations. And then not just animal health, but how that's linked to human and environmental health as well. One health is a term we use a lot in our field, but really being able to pull all those skills together was a huge interest for me and having a big impact.
Yeah. Well, we mentioned that you were named Iowa State University's COVID-19 Public Health Coordinator earlier this year. You're leading the university's strategy to mitigate that risk of COVID spread on campus. What is this role the past few months as students kind of transition back from break back onto campus here in Ames?
Yeah, it's, I would be lying if I said it wasn't incredibly stressful. Certainly, as the pandemic has been for everyone, we're learning new things all the time. The situation is constantly evolving, but it's been incredibly rewarding and meaningful work. I've had the opportunity in this role to really put all of my different skill sets and past professional experiences to good use. And the network of people we have working on Iowa State's campus towards this common goal of trying to protect our campus community to the extent that we possibly can, and hope that everybody can have as good of a semester and close to normal as possible. It's been a huge undertaking, but a good cooperative effort that I've enjoyed being a part of.
Yeah, we're seeing some of the video of the testing that took place before students actually started classes. So tell us about kind of the process that you and the task force, the team went through, that public health team, to get organized and to get ready for this return to class for students.
Sure. So we were very lucky here at Iowa State. We had an emergency operations center that had been activated clear back at the end of February that truly helped to streamline our efforts. And so that is for anyone that's not familiar, it's a setup where you have a very direct line of command. It helps to streamline efforts, but you still can pull in all these different experts from across campus. And so that group, along with our public health team, was responsible for planning the back to school testing that we did. And it really enabled us to do it safely, do it effectively, but most importantly, do it efficiently. And so we were able to utilize those limited resources we had. That's been a huge struggle with this COVID pandemic, is just testing supplies and things like that. So we wanted to be good stewards of all of those resources, and we were able to do that successfully, even with the surprise of the derecho that came through during while our testing site was open actually that day. So.
How much did your experience working in public health, your work for the Iowa Department of Public Health, prepare you for the work that was ahead in this role?
Yeah, it was hugely helpful in my education as well. So really, when we're trained, the way that we work through outbreaks and different things at the state health department, of course, there's lots of different partners involved in all of that. And so having those relationships with our state and local public health partners was hugely important. But also just the processes that we use to work through those things. Outbreaks and pandemics are incredibly complex. As we've all seen with COVID-19, it impacts so many different people in so many different ways. And so you truly need to bring people together from all different areas of expertise. And my past experience in education truly helped me to be able to work with other people successfully to address all the different needs.
I think it was pretty widely known that when students came back, there was that spike in positivity rate that was kind of alarming. Ames was one of the highest in the country when it came to positivity rates. So if people really have been following it, though, I mean, the last week it was down to about 3% positivity on campus. Do I have that number right, Kristen?
Correct. Yep.
Yeah. Yep. What was really the driving force between getting those numbers down from the start of the school year?
Sure. So it was truly an all hands on deck effort. As I said, we're pulling all these different people in with different expertise. One of the key things that has really helped us to be successful with the semester and getting our numbers down and our positivity percentage down is our Cyclones Care campaign. I'm sure many are familiar with that, but that's truly been an effort, not just on our Iowa State campus, but even within our Ames community and beyond. Everyone's kind of adopted the Cyclones Care campaign, and we've got signage and billboards and stickers and you name it. We've been getting the word out, but that campaign really focuses on 4 healthy behaviors that everyone has a personal responsibility to do to help keep everybody safe as possible during the pandemic. And those behaviors are to wash your hands or sanitize your hands frequently, stay home when you're sick, physically distance and wear a face covering. And so we've, worked on that campaign and sending those messages out throughout the semester, and everyone's really taken that personal responsibility very seriously. And with all of the mitigation strategies we have in place, we've been able to get our numbers down.
And I know you guys, each student, faculty members, staff at Iowa State were given face masks when the semester started. Are you still seeing that cooperation among faculty, staff, students here on campus of wearing those face masks in class and even when they're among their colleagues and their classmates?
Yeah, we really have seen very good compliance with that. And again, I think that's due to that, continuous messaging that we're doing. It's particularly important at this time of the year, as you mentioned at the beginning. The temperatures are getting colder outside, and so we're all going to be spending more time indoors. So we're continuing on with the vigilance that's so important that we all continue to adhere to those behaviors. And but we really have seen great cooperation among our campus with following those Cyclones Care behaviors.
Sure. If there are some parents or Cyclones watching this, what do you want them to know about the future plans for what's going to happen on campus, maybe as the semester comes to a close and as we look towards next semester? What are the plans on campus as it relates to COVID-19?
Sure. So definitely want everyone to know, and I know I've said this a few times, but just that it is an all hands on deck effort. It has been since the pandemic started, and it will continue to be in the coming months and into spring semester. This is a top priority that we keep everyone as safe as possible. And so we, as I said, everything is changing constantly. And so we really try to keep on top of anything that we need to modify or do differently as we learn more about COVID-19. One of those things we're looking at is our testing strategies. So that's something we did the testing during move-in in the fall. Right now we're finalizing plans for what testing will look like in the spring when our students come back. And so everyone can be looking for messages about that soon. And then also the different communication we want to do with our campus community as we disperse at the end of fall semester and prepare to spend some time with our families who may be at higher risk. Some individuals certainly are, and what behaviors we all need to do to keep everybody safe.
I know recently you guys also started this random testing among students. How has that gone so far in the few weeks you guys have been doing that? Have you seen some positive results as of that?
Yeah, we really have. It's gone well. We're continuing to modify that plan, and if we want to continue to do that into spring semester, a lot of that is always, again, dependent on those resources and how available those resources are. But it has been positive. We've seen individuals who have been very willing to do their part when they are randomly selected to come in and test, and we've seen very low positivity as a result of that testing, and we will be releasing a summary of that information here shortly.
Sure. Kristen, Iowa State graduates are really using their degrees to make positive influences in their communities, their states, here in Iowa specifically with you. How do you feel like you've been able to make a positive impact here in Ames in the state of Iowa?
Yeah, it's truly been an honor serving in this role in particular. I've always felt as though my career path and my skill set and the education that I gained at Iowa State has allowed me to help other people, animals included, and that's been my main goal with my career. But in this particular role, I've truly been able to feel like I'm out on the front lines, having an impact. And along with that comes the stress and responsibility of, feeling personally responsible for our campus. But that is what makes Iowa State great, is we truly do care about each other. This is a caring community, and we work so hard to try to protect each other and make sure that we can continue to have the best college experience possible for our Cyclone community.
Sure. Well, I also know that you, COVID aside, you are the owner of Lunch Socks. Tell us a little bit about Lunch Socks. People may have heard that company or that term. Tell us about Lunch Socks and how you guys are working with, helping feed. I think you're working to feed kids, right? With the proceeds that you guys are, or Feed America. That's what it was, Feeding America, with the proceeds and the sales from Lunch Socks. Tell us a little about that.
Sure. So I had gotten to know Rebecca Lyons. Many of you probably know her. She's an Iowa State alum as well, and the founder of Lunch Socks. I own a fiber farm, so I own sheep and alpacas, and I'd gotten to know Rebecca through that. And she decided to sell Lunch Socks earlier this year, and so I had the honor of purchasing that organization from her, and have had a great time. Of course, not knowing that I was going to be coming into this COVID role has made things a little more interesting. But certainly COVID even has provided some great experiences. And so what we do with Lunch Socks is we locally source the fiber and then have socks, natural fiber socks, so wool and alpaca socks made through local companies in Wisconsin and Minnesota. And then we have the socks for sale on our website, and all profits go to fight different hunger efforts. So we pick a different cause each year. This year we're doing Feeding America. We are going to do a week-long sock drive beginning on Small Business Saturday, right after Thanksgiving, to benefit our food pantry here on campus, to try to help our Iowa State community do a little local effort. But all profits go to fight hunger, and all the while promoting some local businesses that make great socks.
Well, you definitely stay busy.
Yeah.
between your work at the College of Veterinary Medicine, on the COVID task force, and with Lunch Socks and your other work. We appreciate you taking time for us today, Kristen, and thanks so much for partnering with the Alumni Association to share all this great information. Thanks again.
Absolutely. Thank you. Happy to be here.
All right. That is Kristen Obbink. Thanks to her for joining us today, and thank you for listening. Want to remind you, next week we'll be talking with Greg Smith. He's the fire chief of the Cedar Rapids, as well as a life member and board member here at the Alumni Association. Obviously, Cedar Rapids hit very hard by the derecho a couple months, so we'll get to talk to Greg Smith a bit about the recovery effort out in Cedar Rapids. So that's it from Size Lounge for this week. Please stay safe and have a great rest of your day, and go Cyclones.